I think it's essential to have prolonged nutrition therapy combined with exercise rehabilitation through every phase of critical illness and recovery. It's a patient journey, and we will deal with several aspects of nutrition therapy during this journey. Most patients need 2 weeks to meet the targets, and less than 25% meet this actual target. So most of the patients are malnourished or underfed in our ICU. We found that the removal of the feeding tube, we see an immediate drop in energy and protein intake of at least 30%. So it's very important to notice this and not to remove the tube too early.
When you leave ICU, you first look at the first part of their journey, which is after ICU, and then you look at rehabilitation centers or at home. When patients are only eating, they are not reaching their targets. Every single publication on nutrition post-ICU reveals the fact that patients are massively being underfed. But when you see that there is an active nutritional care plan, this goes up to almost 90% of what they need. There was a testimony from a Belgian actor. He suffered intensely. He lost 12 kilos on 12 days. And he says the pain I am in, the difficulties I have now to recover are so harsh. And I want everybody to know that you need the protein to build your muscles. You need the building blocks to be able to convert this feeding into actual power and muscle and energy. Nutrition is a part of the solution.
We have to focus on not just winning the battle in the ICU, but then fearing losing the war of the patient never returning to the quality of life afterwards. Clearly, to recover our patients, we're going to need a combination of good nutrition, good rehabilitation, and perhaps some guidance from what elite athletes do to optimize their aerobic and strength recovery. I think we can learn a lot from the science. You need more protein to gain the same amount of muscle than you did when you were young. But when you're critically ill, that becomes even more dramatic. Recovering from ICU really is the marathon of our patients' lives. This is one of the oldest men to run a marathon. He was 85 years old when he did this. So I would advocate to even very elderly patients can survive if we prepare them and recover them correctly. Patients are not going to take in enough oral nutrition in the post-ICU period. COVID patients, I'm noticing, feel even weaker. They're still short of breath. They're still on oxygen. They eat even more poorly. Oral nutrition supplements are the only way to deliver these needs. And I think the use of high protein ONS for a minimum of 6 months to a year after ICU is essential. ICU recovery begins the day of ICU admission, or before for our surgical patients perhaps. And it continues long after hospital discharge.